Are you coming down with a cold, or could it possibly be COVID? With restrictions easing, doctors are seeing more patients with cold-like symptoms, some testing positive for the coronavirus. Joining us this morning, Harvard Healthcare's Dr. Syed Hussian, Medical Director of Urgent Care and Occupational Medicine, Fairfield Region. Thank you, Doctor, for your time this morning.
Thank you very much.
Dr. Hussian, are you seeing more people coming in with symptoms of a cold right now?
So with the ease of restrictions and people being more, outgoing and now they're going to the concerts and ball games, and with the summer cold, we're seeing a lot of cold symptoms, upper respiratory infections, coughing, sneezing, and among some of them, there are positive COVID cases.
Yeah, so we're sort of in that time where people who are vaccinated, a majority of them probably don't think that it could be possible for them to have COVID, but are some of them testing positive for COVID-19?
Not all of them, because as our protocol that someone with the cold symptoms, with cough, congestion, fever, body aches, if they come to the walk-ins, we test them for COVID.
Okay.
And one of the 4 cases, I would say, are turning into positive. And primarily, these are the people who have not been vaccinated.
Oh, okay.
And occasionally we see some breakthrough cases, people who have had vaccination 6-8 months ago, now they're coming down with some cases of positivity. So I think it's a mix, but definitely a rise in the number of young people getting COVID because of the Delta variant.
The Delta variant, obviously highly transmissible, something we have been hearing a lot about. What has that been like for people who are vaccinated getting the Delta variant compared to those who maybe are not vaccinated? What are the symptoms like?
So one of the advantages of getting vaccinated is that it protects from the Delta variant. So we are seeing the surge of Delta variant cases in people who are mainly unvaccinated. They're young people. They feel that they can ride this out. We are still in pandemic, and there is, this is what I would say that is likely an epidemic within the pandemic because of these young people getting higher cases of positivity rate.
Here's a tricky question. How do you know if you have a cold or if it's COVID symptoms? How can you tell the difference?
The symptoms are parallel.
Okay.
Most cases, they have cough, the congestion, body aches, fever. They both are viruses. But when you start having symptoms of loss of taste and loss of smell, high fever, shortness of breath, that tilts more towards the COVID. And obviously, you have to be tested for. If it's tested positive, then it becomes totally a different ballgame. Cold, summer cold, upper respiratory is still around. We are seeing a lot of these cases, but among them, there has been some cases with positive COVID and Delta variant cases.
And even for the common cold, doctor, do you think that we're seeing more of it right now because so many of us are no longer wearing the masks, we're not social distancing?
True, Alyssa. I think what's happening is that people are feeling more comfortable now. They're going outside, they're taking the mask off, going to the restaurants and ball game, and feeling more comfortable. But I think the Delta variant is so contagious that even if you are vaccinated, I still suggest that they should have a mask on. And if they are in an enclosed place and they're into a tight spaces when they have a lot of people, use the mask. Yeah. Use the right thing to do.
And my final question for you this morning, what do you think about testing? You know, if someone is concerned, if they feel like they have a cold, but they're not sure, again, we've been talking about this, is it a cold? Is it COVID-19? What should people do? What should the testing be like right now?
So if they have a cold symptoms, don't take it easy and don't take it light. Come to the walk-in, go to your doctors and get it tested. If it's positive, then it's a totally different issue. But cold symptoms have parallel symptoms with the COVID. And I highly encourage that if they have a cold symptoms, the cough, congestion, sinus infection, come to the walk-ins, go to your doctor and get tested.
Some good advice, Dr. Syed Hussian. As always, we appreciate your time, and I Can't go without saying thank you for your work always, but especially given the coronavirus pandemic, we know how hard healthcare workers have been worked, so we really appreciate all that you do.
It's a pleasure. Thank you.
Absolutely. And for more information, you could always head to hartfordhealthcare.org.